Okay. Ready? Weekly meeting, come to order. Pledge allegiance first, please. Thank you.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
For the next item on our agenda,
Just a minute. Point of note, Commissioner Schweitzer will not be here. He's recovering from some minor surgery today, so he won't be not be in attendance. Okay.
for the next item on our agenda, we have the minutes and claims from the Vigo County Auditor.
Okay, we've got September 28th minutes to be approved.
I've reviewed them, and I'm good to move forward with approving the minutes.
Okay, second. All by aye?
Aye.
Aye. Okay.
And next up, we have the September 25th through October 1st claims in the amount of $373,288.31 plus payroll of $1,022,578.49 for a total of $1,395,866.80.
Questions?
No, I'm good to go, so I'll
Move. Aye. I'll move to approve.
second.
Second by aye? Aye. Okay.
Next item on the agenda, we have a back on track presentation for the Vigo County Health Department.
Vigo County Health Department. Yes,
Do you know
ma'am.
who's giving it?
Joni, I thought. We can move on and come back to it if you guys would like. Yeah. Okay. Moving on temporarily, I think we have a presentation from Hamilton Center today.
Excellent.
Can I start?
Oh, yeah, please
Okay.
begin whenever you'd like.
Okay, it's going to be kind of two-part. I don't know the procedures here yet, but my name is Melvin L. Burks. I'm the CEO of Hamilton Center, and I've been employed at Hamilton Center for 43 years. And we're here to talk about some of the services that we provide to Vigo County. And I'm going to allow the Chief Clinical Officer to provide the detailed information. So I'm going to ask for Mr. Collins to come up and speak. Mr. Collins.
Thank you.
All right. Good morning, Commissioners. We appreciate the opportunity today to present to you the information regarding our fiscal year 21 annual report. We did send this in December of 2020 to the Commissioners and the Council. But we're here today to present to you guys, on behalf of our CEO, the information that is required of us as your local community mental health center to present each year regarding the services as outlined in the Indiana Administrative Code through Department of Mental Health and Addiction. In your packet, guys, we brought three packets today. You have the Vigo County report, specific to Vigo County. I want to talk just a little bit about the services that we offer, and then we can go into that report. First and foremost, I don't know if you know at this point, but Hamilton Center is celebrating its 50th year in existence. This is our 50th year anniversary. So we've been here in the Vigo County community and our other communities for now 50 years as an organization. And we're very proud of the services that we provide to the individuals in Vigo County and the 10 other counties in which we provide service in West Central Indiana. Here in Vigo County specifically, I just want to talk briefly about the services that we offer. Comprehensive Community Mental Health Center. As you are aware, we have 4 adult group homes. 3 are located in Vigo County, 1 is located in Indianapolis. We have 2 transitional living houses, Oak Street and Eagle Street. One serves females, one serves males, 9 beds each. They both are here located in Vigo County. We have an early Head Start and Healthy Families program that operates out of our Child and Adolescent Services building located at 500 8th Avenue here in Terre Haute. We have a clubhouse, an adult clubhouse that's located on South 13th Street. It's called Infinity House. Offers peer-to-peer support for individuals who are seriously mentally ill. We have applied for and received a FQHC lookalike designation for both Vigo County and Putnam County. We have a CCBHC, or Certified Community Behavioral Health Clinic grant from SAMHSA that we are now in year 2. It allows us to expand services as far as a mobile crisis unit and 24-hour access care. We have an inpatient unit of 16 beds located at our 620 8th Avenue address here in Terre Haute. We have specialized programs that work with individuals of the military veteran population and military-connected individuals. We have a homeless outreach coordinator. We also have several school-based initiatives and school-based director that assist us in establishing services in all of the schools. We do provide service to all of the schools here in Vigo County. It's just an overview of the services that we offer as a regional behavioral health center. In your packet, you'll find the report. Just want to go through this. Again, as outlined by DMHA, there are certain requirements that we are to report each year. We complete these reports for all 6 of the counties in which we are the designated CMHC in Indiana, and send those off. As of 2018, DMHA had created a specific template, is what you have in your packet today, for us to provide this information. Prior to that time, there was no specific template for us to provide the information as an update. We're required to provide that update to the commissioners and the council. Briefly, on the front page of your packet, you'll see 2030-2020 is the date that this was completed. It lists all the individuals on our board of directors and illustrates that this is the, although it's the December of 20 report, it is the fiscal year 20 report. Fiscal year 21 that ended in June of this year will be due this December. These reports are due by the 31st of every year. So basic outline, commissioners, is that you have information regarding the number of patients served in the county. As you can see, 5,865 individuals served, again, specifically for Vigo County only. It does not encapsulate all the consumers that we serve across all 11 of the counties in which we provide service in. It does detail the number of patients that receive both addiction and mental health services, so what we would call co-occurring disorders, individuals with mental health and substance abuse related, 1,255 individuals. On the second page there, you have a breakdown of the referral sources that we receive individuals from. And it's also detailed on page 3, the numbers of those referrals: self-referrals, school-based referrals, legal court system, Department of Child Services, etc. On page 4, you can see that we have a pie chart regarding the payer sources for Hamilton Center. As you are probably well aware, we are 61% Medicaid, Hoosier Health-Wise, or HIP 2.0 plan, so a lot of our individuals fall well below that 200% of poverty level, which is exactly what the CMHC is designed to do, which is serve those most vulnerable populations. The next page illustrates the number of youth served in Vigo County by age range. So 0 to 12, 13 to 17, 18 to 24, 25 to 44, which is our largest population of 38%, 45 to 64, and 65 plus. So again, you have that breakdown of the average age of individuals served. On page 6, you will start to see an outline of all of the community outreach that we've completed in fiscal year 20. Includes, again, judges, prosecutors, our community partners, our sober living environments, pain clinics, Union Hospital, Vigo County School Corporation, et cetera, et cetera. We also list the community meetings in which we are a part of, we participate in as a community mental health center, including the Department of Children's Services, the United Way of the Wabash Valley, and our local coordinating councils. We have a brief list of events that we attended as well as Hamilton Center, representing the community and being a part of the community. And continuing on page 7-8, you will see the number of new programs that were initiated during the fiscal year. Continuing the conversation regarding the Military Veterans Program, our Certified Behavioral Health Clinic, our CCBHC, which you have heard quite frequently about. We're in the second year of that grant. Allowed us to create a assertive community treatment team, or an ACT team, that serves those most vulnerable individuals, most acute individuals with serious mental illness. And again, our 24-hour crisis mobile unit that will go out on site to provide crisis services to those individuals in need. On page 8, you will start to see a breakdown of our addiction services. What we offer here in Vigo County, as far as the addictions office, which is located behind the courthouse, Wabash Court. Our Vigo County outpatient program, which is located at the 628th Avenue. Our Child and Adolescent Services building, which is located at 500 8th Avenue. Oak Street and Eagle Street, which is our 2 transitional living houses that I spoke about earlier. And then the evidence-based practices, or what is commonly referred to as EBPs, that are utilized. It lists the detail of the number of adults provided addictions treatment in fiscal year 20, 1,759, and the number of youth provided treatment in fiscal year 20. The subsequent pages have the bar graph of the top 5 primary substances used in Vigo County. I'm sure it may come as no surprise. The top is stimulant, which includes methamphetamine, amphetamine, cocaine, crack, etc. We know that here in West Central Indiana, we do have a methamphetamine problem that we continue to try to address, followed by alcohol use disorder, cannabis use disorder, opioid use disorder, and tobacco. On page 10, you'll start to see the breakdown of our mental health services, the locations that we offer services for youth and adults, the evidence-based practices that we implement while working with those populations, and the number of patients served regarding adults' mental health treatment and youth mental health treatment as well. And finally, Commissioners, on the last 2 pages, you'll see a breakdown of the top 5 diagnoses for youth and the top 5 diagnoses for adults within fiscal year 20. As you can see, for adults, depressive disorder and substance abuse related addictive disorders top the list, most commonly referred to as co-occurring diagnosis with individuals who have a substance use and mental health problem. That completes the information on the annual report. I do want to just provide some other information for you that's not included in the report, but we think is significant in the conversation regarding the Community Mental Health Center. We have a breakdown of the number of individuals that we serve. We also have a breakdown of the number of individuals who are under 200% of poverty level. And again, Commissioners, this is included in your packet. 5,392 individuals in Vigo County are under the 200% of poverty level, meaning 89% of the individuals that we serve fall well under that 200% of poverty level. In fiscal year 20, we provided 5,435 days of inpatient behavioral health treatment in our 16-bed inpatient unit, and we provided over 156,000 outpatient services. For Vigo County, obviously Hamilton Center is an organization of over 600+ employees. The majority of those, 465 individuals, reside here in Vigo County. So salary and benefits, $13 million in salary and benefits to those individuals who are employed in Vigo County, and another $15 million in expenses accrued in Vigo County. For fiscal year 20, we provided $2,300,000 in charity care. These are services that we do not get paid for. We either adjust or write off based on the clinical necessity for us to serve those individuals who have behavioral health or addictions-related issues. And it also lists the dollar amount as far as Vigo County tax support that we receive as a community mental health center. At the very bottom of this page, we have a few other information about the programs that we've started that you heard me talk about a little bit, our FQHC lookalike, our OTP here in Vigo County. We have 3 OTPs, one in Vigo County, one in Knox County, and one in Hendricks County, 2 of which we opened during the pandemic in 2020, Knox County in May and Hendricks County in October. So that would conclude the information that we wanted to present this morning, Commissioners. We are very proud as an organization of the services that we provide to Vigo County and the other 10 counties that we serve in West Central Indiana. want to know that we are dedicated to be a great community partner. Obviously, Vigo County is our home base, where we originated, and no more, I think, than needs to be said as far as us being in the communities for 50 years in providing services, and we're very, very proud of that. So on behalf of our CEO, Mr. Melvin L. Burks, would entertain any questions that you may have regarding the information that I presented today.
So, wrap up for 2020. What do you see was a success or successes for your program this last year?
Great question, Commissioner Morris. Multiple successes. One is we're predicated on a foundation of one thing, really: serve clients. It doesn't matter where they're at. They can be incarcerated. They can be homeless. They can be living in poverty. They can be in community housing, sober living. We're going to go wherever we need to go to serve consumers. I think some of the highlights, obviously, we opened 2 O2Ps, opioid treatment programs, in a pandemic, as requested by the state of Indiana. And we continue to further our CCBHC and FQHC grants that were awarded through SAMHSA for the CCBHC and HRSA through for the FQHC lookalike. And again, our mission and vision is just to serve consumers. And so I think, there's a lot of highlights. We're proud of all the success that we had in serving the number of individuals. And one thing that we always keep in mind is, what can we do next? What can we do more? How can we do it better? How can we continue to serve more individuals in Vigo County and the other counties, along with being a great community partner? What else can we do to be a great community partner?
Okay, thank you. You want to wait till?
Mark, thanks for your presentation, the information. I know this is sparked because of my request to get the last 5 years of data, because we couldn't find it. So just because we didn't find it doesn't mean it wasn't submitted. It just means we can't find it. Are you okay with us scanning all these reports and putting them on our files as our partner, so that people can have public access to it?
Oh yeah, these are listed.
It's on the state side.
Yeah, it's on the state website, Commissioner
Okay,
Kearns.
so are you okay with doing that, Karen? Just some clarification. You and I have had some conversations about the CMHC relationship and what that means. It's somewhat new to us, because recently through a conference, several attorneys says, hey, this is what we all should be doing for each other. And you've helped answer those questions. One of the things you have in here is Vigo County tax support, $694,850. That money is actually there because in the 1960s, and feel free to jump in and steer this appropriately. The state says, hey, counties, you're in control. You need to take care of your own mental health in your backyard. You need to take a portion of your property taxes and fund mental health services. And I guess that's a simple way to kind of, a basic way to explain it. That's where that number comes from. And actually, the number that I have is $30,000 less than what's in here, so, which is no big deal. Unless you're the one needing the extra $30,000, I guess it is. But it's not just our contribution. Our contribution also guarantees a match from the state, if that's correct. Is it a 2-to-1 match? So if we're giving you $700,000, does that mean, since you're our CMHC, that the state's giving you an extra 1.4? So our relationship's worth about 2.1.
It allows us to pay, as part of the Indian Administrative Code, it allows us to use those tax dollar funds to pay our required match for Medicaid from the state of Indiana, knowing that we, Commissioner Carter, we provide many more services and pay much more match than what those county tax funds will assist us in matching. But absolutely, those funds are utilized or can be utilized for that.
I think it's good for people just to understand, and this is as I've learned about this process, that Hamilton Center does its own thing, and they do a great job. You are our CMHC, Community Mental Health Center. County commissioners choose who their CMHC is. This relationship has probably been with Hamilton Center from day one. so that money goes to you, that you are not it's hard to articulate this. We are not in the business of providing mental health care. You guys are. We are supporting your initiatives, I guess is the best way for me to explain that.
Yeah, those tax dollars, the way I understand it, Commissioner, and, anytime you look at any administrative code, it can be confusing. But those dollars are there for us as a communal health center in Vigo County to exist, to provide services to every individual in Vigo County, supported by the tax funds, absolutely.
And you're in 13 counties where you're the CMHC?
No, sir, we provide service in 11 counties.
11 counties.
We have 6 counties that are our original catchment areas. Essentially, what we refer to a catchment area, Commissioner Kearns, is we receive those county dollars from those counties.
And only 6, out of the 11, only 6.
Correct,
And we're your largest out of the group.
correct.
Okay. I don't think I really have anything else.
Are we meeting at 10?
Yeah, we're gonna have a sidebar conversation with Mark.
Okay.
And Mark, thanks for coming in and doing this. I know last year was tough for meetings in general. A lot of our stuff was virtual, so I appreciate you taking the time and providing the info.
No problem. And we will continue to make sure that we do these annual reports. So again, during COVID, we usually have someone that comes in January or February to the commissioners' meeting to present the information. Excuse me, sorry. But obviously with COVID, we weren't able to do that. But we recognize that we'll continue that process as we move forward next year.
Well, we often get emails from you guys in packets, and it's easy to overlook packets, but yeah, I know there's a session you guys have at 10 o'clock today that I actually signed up for, but I'm skipping because we're gonna chat. So, but I appreciate Hamilton Center's outreach. I know all 3 of us appreciate your outreach and what's being done for the community.
Yep. Okay.
Thanks, Mark.
Thank you.
Next item on the agenda, we have comments from commissioners or other elected officials.
Yeah, I don't. Where are we, Joel, with, never mind. We're good.
All right, if not, we'll move on to comments from the public. Are there any comments from the public? Michael's not received anything, and I have not.
Did you relay to Joe? The Health Department presentations next week. We're a week ahead on that, so that,
Okay. All right.
Just to make everyone aware, the health department's going to present next week. We were a week ahead on our agenda items.
Okay. You have nothing? I have nothing.
I don't know, I was hoping somebody just give an update of some sort. Kevin, do you want to give an update? Actually, you made me think of something. Jim Bramble, tax sale. Hi. Yeah, how'd the tax sale go?
Well.
Thank you for that dynamic presentation.
I think it was in the neighborhood of $3 million worth of stuff we sold. I don't have the report in front of me.
Okay. I tried. Diana, you want to, your department, share good news? Yeah, I'm sure there is. You don't? And I know Bruce has nothing, so, all right. How's surveying going, Bruce? Yeah? What are you surveying nowadays? Roads, that's good. Good job, Bruce. Yeah, I officially give up.
Yeah, there's a lot of there's a lot of moving pieces, and the county government continues to move ahead and get the job done for the people of the county. I think drainage board meetings, runoff DNR meetings commissioners meeting with DNR on some things, just several different things, and they're all moving ahead, and I think they're all going to have a positive impact. Tax sales, yeah.
I think that, have you realized that we'll never figure out what this job actually entails?
It entails a lot.
I had 3 new
When
things
somebody
come
can't
up
figure out
yesterday.
where it goes, they put it in the commissioner's ball field.
A lot of neighbor fights we get in the middle of.
So, but it's okay.
That's right.
All right.
Recess before we
Recess.
just keep rambling?